Our guest who's wanted to speak to on the phone has now joined us on the phone. She's Jacqueline Mogeni. She's the CEO of the Council of Governors. Good morning, Jacqueline.
Morning.
Thank you very much for joining us and welcome to the Situation Room.
Okay, thank you. Thank you for having me.
In the previous hour, we were speaking to Governor Kivuta Kibwana from Makueni, and before we went into his presidential ambitions, we started by looking at what the Makueni is doing to address COVID-19 and the preparations that have been put in place by the county government on COVID-19. Now, we want to discuss with you the same from where you sit at the Council of Governors. Now, the burden shifts, and we are looking now at all the 47 counties. Each of them has to be ready for to deal with COVID-19. From where you sit, how are they looking?
Not bad.
Not
the
bad.
counties actually.
Could you
The
please
counties,
expound on what is on the not bad?
You know, when someone says not bad, it's instructive to know that they didn't say good.
Yeah, they are okay. Actually, they are ready to deal with the emergency, the pandemic. Of course, we all know that every other country, even the developed countries, get overwhelmed by this pandemic because sometimes it's like it begins to sprout, all seeds begin to sprout at the same time. So, if that happens, the truth of the matter is that they will experience challenges like any other country. But as we speak, they have already established their county emergency response committees, which coordinate the emergencies up to the household, up to the household level, because now we've moved into home-based care, and many counties have prepared. Their county health volunteers are working from house to house just to educate the masses, but also tell them what needs to be done. The guidelines that have been provided by Ministry of Health and the protocols by the Ministry have been adopted, and they are being implemented across all the counties. If you talk about quarantine, all of them have, 47 counties have about 18,838 bed capacity in terms of quarantine facilities. There are about 933 people in quarantine as we speak in 38 counties. About 382 of them have already been have tested negative, and we're expecting that they should be released so that those beds will be available for other people. So we're just waiting for the final test, and then they can go home. So in the last 1.5 weeks, for example, there's been a general decrease of people in the quarantine facilities. And we think that, and we'll be hearing that in the next press statement next week, to see what is the number of people who are in self-quarantine at home. Because we're encouraging people to do self-quarantine in all the 47 counties. And then in the event that people need to be isolated, we have about 11,760 isolation beds in all the counties. So we can be able to deliver jointly for all the counties, together with some at national level. We can be able to deliver about 30,500 isolation beds. So that tells you that in the event that the disease go to that level, we are ready. In the event that it exceeds 30,000, then of course we are going to face a problem, and not because we are not prepared, but because it will be overwhelming.
But may I ask, do the counties also have corresponding personnel to meet the need?
Yes, we have trained about, in terms of personnel, we've trained about, can I even remember the numbers offhand? Yeah, so far we have about 8,680 human resource staff that have been recruited, and they have already reported their workstations. In addition to the personnel that we already have in the counties, we had 26,000 nurses then. So we've added an extra 8,000, and all these are nurses because we've not really added doctors. We've added nurses and clinical officers. We had about 4,000 clinical officers before. So in addition, so now they are ranging in the region of about 8,000. The Ministry of Health, national government, has actually supported counties to add this extra staff, and they're going to do another phase 2 of recruitment. They are on contracts for about 3 years. So yes, we have enough personnel. We've also about 11,000 thereabout community health workers. So yes, we have community health volunteers, we have nurses, we have doctors. all of them ready. But of course, we're not going to deploy all of them for COVID. There are other diseases that we are also handling. You see, because some of our indicators have started to go down. So we need to enhance immunization for the children below 5 years. There are NCDs, the non-communicable diseases, we are handling that. They have to go to their clinics. HIV/AIDS is a challenge. It had gone down. People are fearing to go to the hospital. So we are using the CHVs to go to the communities to look out for those who have gone underground. Because if they do that, you see the disease can mutate, especially for people who are TB patients. So we are ensuring that both services are going on. So we have facilities that we reserved for COVID, and we have the others going along. So yes, we have, but for sure the health workers are not enough because they work in shifts. It's a very heavy responsibility to take care of COVID patients. So they work in shifts. So they are not enough. We have increased the numbers, but they are not enough. They are for sure going to get overwhelmed if the disease goes beyond the numbers that have been given to us by the command center.
Would you say that all the counties have sufficient protective gear to ensure that they deliver the services that are required of them?
On the PPEs, let me just say that the PPEs is a big challenge because the counties were purchasing the PPEs, and of course, at first, the PPEs had to come from outside. We know what happened when all the borders were closed. The PPEs were not able to come in. So then we got to buy PPEs locally. Some of the quality was very poor. This was the issue of quality is KEBS responsibility, not counties. So we're getting some PPEs that were of very low quality. You heard about the numbers of the community health workers. The health workers who've been infected, and they were attributing this to poor PPEs quality. Now the Ministry of Health told us last week that we shouldn't purchase any PPEs. They have enough PPEs to supply to the counties. So they asked us to do accumulatively a table and a request and send to them. We sent to them last week. Yesterday, the PS said they will begin to distribute this PPE through cancer. So as we speak, PPEs are not enough. We are waiting for the supply from the Ministry of Health because they told us not to purchase, to use the resources instead to ensure we have adequate beds, the 300 beds. So counties are focusing more on the beds now. PPEs, the ministry has told us they are giving us. So if you hear there's no PPEs, it's not our fault. We are waiting for them from the ministry.
Jacqueline Mogeni, the CEO of the Council of Governors, is on the line with us in the Situation Room this morning. We're looking at how counties are setting themselves up to prepare for a likely upsurge of numbers of COVID-19 patients. She's giving us the number. She's telling us, she's sounding very optimistic and positive that the counties are actually putting in place very good measures to prepare for this. Let's continue this conversation.
Counties are ready. You've got the community volunteer systems in place. And you're awaiting the PPEs from government. I have a couple of questions. With regard to the testing kits, are those enough? And then with regard to resources, we note yesterday the governors made a statement about money. Now, it seems that there's a shortage of money. What is playing out in that regard, and in what way might that impede the county's ability to respond?
Okay, now I did not say that we are waiting PPEs from national government only. We already purchased some, and so as we were opening up, there was an agreement that the country will begin to open. We were advised by the Ministry of Health that we shouldn't continue buying the PPEs. That the resources we have that we were given by His Excellency the President, 5 billion, should be committed to not 5 billion for every county, 5 billion divided according to the disease burden to all the counties. We should now use it to do the beds, buy ventilators, equip our ICUs, and so most counties are doing that. As I say, 26 have already reached the 300 bed capacity. 21 haven't, and so we are waiting for additional PPEs because we had some. But remember, they are not enough because cumulatively we have about 64,283 community health volunteers who we have now trained and sensitized on COVID, who will be responding to that COVID. And now that we are going to home-based care, so they can't go to the home without PPEs because they'll also get infected. So you can imagine that we need, and the ones that are disposable, you only use one. So if you get disposable, 64,000, one. But if they're doing contact tracing and all this for home-based care, they will need the ones that you can use maybe for the whole day, and then they can go for laundry, and so it's a whole mix. So that is where we are. We are prepared, yes, but we know that there are those disadvantages. Now on the testing kits, remember, county governments do not test. We collect samples, and then we send them to the national influenza laboratories and the Cambridge, the laboratories that have been set apart by the Ministry of Health. And sometimes it takes so long. Like, you can imagine a place like Wajir sending them, so a place like Mandera. So now Wajir laboratory was certified, but we don't have testing kits because testing kits are supposed to come from the national government, from the Ministry of Health. So that is where the problem is. We collect the samples. It takes like a week or so to get the samples tested and then send back, the results sent back. So testing kits, we don't have enough, not because the ministry is not able to provide, but because they are coming from outside and we cannot be able to access them, especially when we are across the border. They were coming in kidogo because the whole world is depending on these testing kits. We have the machines that could do this testing, the gene expert machines, but we don't have the reagents again. So it's a long story about testing. So that is where we are.
So you're saying that the 5 billion shillings is being shared out among the counties, and mainly it's going to infrastructure, buying beds and kitting those hospitals and buying the ventilators.
Yeah, so maybe if I could just quickly tell you, like for example, we've set up on the intensive care, the ICUs. Cumulative in all the 47 counties, we have 447 ICUs. And then we have 437 ventilators across all the 47 counties. Now, the ones that are ready.
Yep.
There are some counties that for sure do not have any ICU, they do not have any ventilator. So, when the minister said that when you get sick, you have to be treated in your county, that's already a challenge.
Yeah.
And I don't think he means evil. I mean, the reality is, if I got sick today in Nyamira, I come from Nyamira, so how would you transport me to Nairobi? The truth of the matter is I have to be treated there.
You ought to be treated
God forbid
in Nyamira.
if Nyamira does not have an ICU and I need oxygen, I have to be put on some machine. That's it. That's the reality.
Yeah.
I think it's important Kenyans know the truth.
So for all the things that you've said so far, Jacqueline, I think now I understand why your initial response then was okay, because there seem to be so many holes here and there, from ventilators to testing to collection of samples to beds. So then really, if you want to do a check of it, then should the country be satisfied that things are okay when it comes to fighting COVID with the recent measures then that have been put in place, where responsibility now lies on the counties? Is it all right?
Yes, because remember, we are now going home-based care. Surely there's a home everywhere. So if you got sick and you are asymptomatic, you have symptoms which don't need you to be in an ICU, we can manage. We will manage. The only
How exactly do you propose to manage the patient who is going to be at home?
Isolation, I think that's what we've been told. The ABCs for COVID-19 is you isolate yourself for 14 days, don't interact, and so the family keeps just checking on you. If you have a phone, or they give you a phone and saying, the food is put at the door, you pick it.
Keeps checking on you, they expose themselves to the virus as well.
The question is, how do you manage this process?
You see, we have guidelines that have been provided, the home-based care guidelines, and even in the press of the chairman, he said if the radio stations could spare an hour a day just to educate the Kenyans on the ABCs of the home-based care. If you are asymptomatic, for sure you shouldn't be taking up a quarantine bed or an isolation bed, because you can be managed from home, because you're not having difficulties in breathing that you need oxygen. It is just you have pain and all that. That can be managed from home. Remember, we have community health volunteers, 64,000 of them. They will help the guide. They will guide the family on what you're supposed to do. So they will not. You see, they won't come there and then you open the door and then they talk to you. No, they just put the food there and then they knock. The food is out there, so you pick it yourself. When you also finish, you put the plate out there. They will wear gloves and pick the plates, wash them separately. Just like we were treating at first the AIDS patients before we knew how best to manage. It is the same way. So yes, we are prepared to that level. But in the event that it degenerates to a level where everybody who is sick will need to be put on a machine, that will be a problem. And actually, it's not because we are not prepared. It's because it's overwhelming. That would be the statement. Not that the counties were not ready. Only the counties are at the 21. But beds are there. We have beds. machines are the ones that are not enough. But we have isolation beds. We have enough. Really.
The global formula for fighting COVID-19, Jackie, is test, contact trace, isolate, and or treat. So it seems like we are already dealing with the other side of if treatment is needed, we'll have bed capacity. We're working on increasing our ventilators and all. But testing, from the very beginning, if we don't have the capacity to test and we don't have the modalities for contact tracing, how are we going to deal with the other two?
Now, we have, I'll answer the question from the bottom. We have modalities for contact tracing. We have over 64,000 community health workers who have been trained. Remember, there are others who haven't been trained. So the number could be as high as 100, but we are saying unless we train you, you can't be our community health volunteer. Why? Because you need to understand what it takes to to contact trace a COVID patient and to bring that COVID patient to a facility or to educate them on home-based care. So that we have capacity. Now, you see, testing is not the work of county governments because we don't have the kits. We collect the samples and then we take them to the laboratories. We have 12 laboratories all over the country that have been certified by the Ministry of Health, that are being run together, KEMRI and the National Laboratory, Influenza Laboratory. The rest, you see, we can't because we don't have kits. And kits are not from the counties, kits are from the national.
Okay.
And the national is also depending on some importing. So it's not really a blame, is to say that we can't do the testing as is required. So there, for sure, there's an inadequacy, not of our making, but because of the global challenge.
So what is it that's going to happen now in terms of testing? What are the modalities in place? Are you going to say that people will present themselves to hospitals and that's when they'll be detected or screened for COVID-19?
No. We are screening. The screening is being done, by the way, throughout. The thermograms are being done. That is how we are picking out people with temperatures, and the ones who are high temperatures and are asymptomatic are being isolated and being quarantined here. So that one is going on. It is the sample testing that is a bit of a challenge because of the kits.
Which is what I'm asking. Practically, what are the modalities in place? We know that from Mandera, the nearest facility is going to be in the next county or several counties away. So once this thermogun has been used somewhere in a village and somebody has been found to have a high temperature and they're suspected to have COVID, how are you going to establish whether they have COVID so that you can move into the next step?
Okay, let me pick a practical one, matatu. That people are moving all over with public transport. That's very practical.
Yep.
So all public transport vehicles in all the counties are required to have, first of all, sanitation facilities at the bus stops. And of course, with their sanitizers, in the event you don't get a passenger from a bus stop to pick them along the way, they need to sanitize before they get in. Now, before they get in, they'll be tested because that's what the doctors are calling a triage. And they're saying we can pick 80% of the cases from just that triage, a simple tool. So if the scout, whatever he's called, conductor, finds that the person has temperature, he calls, there's a line. All of us, each county has an emergency line, which is known to, which has been circulated, and also the community health volunteer of that area. So the person will not be told, and then you're abandoned there, people are gone, because you could disappear. So then they call the line, it is a toll-free line, and say, we have this person here who has recorded this high temperature. The community health volunteer nearest is like an Uber, is the one who will respond and come and pick this person. Because, it's very stressful to be told you have COVID-19, especially people who don't understand. They just see a death sentence. So they are picked, they are cancelled, and if it's a home-based isolation, it will be done. If it's a quarantine thing, it will be done. If it's an isolation in the hospital, the community health volunteers are the ones who work with us. We're also working with the Nyumba Kumi, the national government structure called Nyumba Kumi. They are security, but now for this purpose, they have to come in and also assist. So we have all those people connected because there are little committees in every county up to the household level and up to the village level. So they're the ones who are helping in picking up these people who have the symptoms and they are asymptomatic. So if you say and the temperature continues to go up, then that's when now the sample is needed. But if you go in, you're asymptomatic and we are managing, the paracetamol is working, there's really no need of taking you into a hospital, to take up a hospital bed for somebody who will need to be on oxygen.
Yeah, Jackie, it's, I think, very good to hear that we have set up this home-based care system all,
on paper.
And hopefully this system will become a permanent way of delivering health, because this is as it should be. So a crisis is creating, is helping us implement something very positive. But I'll go back to the statement made by the COG yesterday, where the chair asked for national government to release funds in a timely way. Which funds are these that are not being released? The chair also said there is a challenge in disseminating information. Who is facing this challenge?
Okay, on the money issue, we haven't received the county governments have not received their June disbursement. And remember, we're in July. The financial year has closed. I don't know the reason. I think that one the National Treasury should speak to it. But all I know, where I sit as the CEO Council of Governors, is that 47 county governments have not received cumulatively 31 billion. That is so critical in helping to deal with this COVID issue. Remember, the resources that we got of the 5 billion, for a county like Kisumu only got 16 million. To do a very good ICU is about 7 million. So those are 2 ICUs only, 2 beds. So I think it's very important the resources that are being held to be released, as the chairman said. And we all know why also. The country has been facing a challenge. The economy almost basically just got to its knees because of this COVID-19. So as much as we want to understand, but we also have a service to deliver. And if something goes wrong in a county, nobody will be blamed but the governor. So that's why the governors are saying, please release the resources, because we need those resources to equip our people, even to just buy the basic medicine, the paracetamol that you need. We need that. And even the allowances we need to give to our community health volunteers. They are volunteering, but they need some transport to go around the villages or a border or something like that.
They need to be facilitated, of course.
Yes, it will be facilitated. That can't come from the governor's pocket. And even so, the governor will not have any money, because remember, if the money hasn't come for June, nobody has a salary.
True.
So we'll be facing a challenge about salaries. And then people will be saying, these governors, why don't they ever pay people? So that is our story that nobody ever knows.
We need facilitation in communication, because communication is important for everybody to know what they need to know about fighting COVID-19. What challenge is it that the chairman was talking about? All the protocols we have are in English. And being medical protocols, some of them are, you see, like when something like in the home-based care guideline, there's something like comorbidity. What is that? I am a lawyer by trade. I have no clue what that means. So you can imagine the community health volunteers are supposed to be helping to unpackage that and tell it to the community. Also, we need a lot of radio programs. So for that to happen, we need the resources. If not, then the national government, it's a bit difficult to expect the national government to communicate to all the 47. I know there is KBC and all that, but really, a lot of citizens listen to FM stations that also speak in a language they understand. Vernacular and community stations.
Vernacular and community stations, that's what we are saying, that we need to be enabled in terms of resourcing. Because in terms of the people, we have enough people. The community volunteers can go to the community radio stations and speak, because people know them. Jacqueline meant to speak on an FM station. They don't know me with Jacqueline, because I'm a bit removed from them. But they are seeing, they know. The governor, they know. So it needs to be the people who they know, because they can ask those people questions that are really, really home, like questions to the neighbor, so that people can understand. So far, that hasn't happened.
But one would expect, Jackie, that during the summits that were happening in the last 1 month between the president and the Council of Governors, in readiness for this reopening of the country, these are some of the issues that were coming up in the conversations.
So the summit is, we can't discuss everything. There are things you can discuss, some things can fall through the cracks. And so it's a learning process. We make mistakes as we keep learning. COVID is not going away tomorrow. So I think it requires also for us to be patient with each other, both levels of government, continue talking. Once in a while you fight, but you resolve it, because it's the same Kenyan that we are. So it happens.
Yeah, Jackie, on Monday we had a conversation about the budget, and we noted that the national government budget is looking at growth as opposed to looking at stabilizing the economy, which in direct terms means they are not allocating sufficient money to the fight against COVID. Could it be that the counties are also doing the same, not stopping non-essential expenditure to reallocate to COVID?
That's a difficult question. Now, the counties we are doing a socioeconomic re-engineering, and now we are calling it recovery. Call it recovery or whatever it is. So, but anyway, that's what it's called: socioeconomic re-engineering recovery study, to help us look at our budgets and see how do we as county governments address COVID in our budgets for this financial year. So we haven't seen the budgets for every county, but that is what the governors themselves are the ones who say this is critical. So we got KIPRA to help us do this study and help and look at the budget, not just the budget, look at the CIDP and the annual plans for each county government, and also ask each county government what are your priorities, and then they advise on how to engineer the normal process, because we can't do things as normal. COVID is here. And then how do we talk about recovery? I'm a bit shocked that that is your analysis of the national government budget, because if you look at the national hygiene program, it's actually not business as usual. It's actually geared towards the recovery of the economy in terms of COVID context, because money is being put in the hands of youth and women, so that they can be able to do the labor, but also earn money and spend it in the economy, so that we can grow the economy. So I don't know whether you're fair in that analysis you said about the national government, because they're also looking at contractors who are doing some of the work, because really there has to be some work going on, and saying move away from machines, do labor intensive, get the youth, get the women. And I think that is a big plus, because the resources that are being put in their hands are going to be spent in this economy and grow the economy the way other governments have done, like Australia.
Okay, Jackie, just as we talked about communication and in terms of what needs to be done, talking about home-based care and the preparedness when it comes to isolation or quarantine centers within counties, somebody sent a message in as we spoke, and Amos says, I'm COVID-19 positive, doing home-based isolation. No one from NMS or the Ministry of Health has come to check on me. And the people that I had contacts with had also tested positive. So, I mean, here we are looking at home-based care as an option, but here's a live example of how it could not be working so far. Looking at a policy on paper, and then in terms of implementation, how then do we deal with issues like this?
I think
this is just one example. There could be many more floating out there.
That's a very good point. The truth of the matter is we don't have all the 7 Kenyans on speed dial. And I think that it's important. That one that you've raised, I think it's very important that, I don't know whether they've contacted, because, every county has its own system. So I don't know what the NMS team in Nairobi is doing, because they have community health volunteers up to Nakuru and everywhere, by the way. And even Nyumba Kumi people, because the Nyumba Kumi team is also helping us to trace and track. So they need somebody. It will not be 100% perfect, I can confess, but that person, it's important that they get in touch. I don't know whether they know the numbers. I also don't know them offhand.
They
but
clearly don't know
They don't know the numbers or what the protocol
And
is
also,
supposed to
Jackie,
be.
this person is among the statistics that are read out by the government on a daily basis. So the government knows that this person is COVID
Exists.
positive.
Even.
Maybe the government has missed that one statistic. So we may not be 100% sure. I think
If he tested positive, then the results have gone up somewhere to some government level.
I think it's important that the FM stations have all the numbers, so that if such a person says, you just tell them, please call this number. Right. So that the person, because it's, as we all say, it's about you.
It's all of us.
Expect the government to look out for us. It's each one of us taking care of ourselves and our neighbor and next. So I think the best thing is to have the numbers of the CHVs and the Nyumba Kumi persons.
All right. Jacqueline Mogeni, the CEO of the Council of Governors, thank you very much for speaking to us today. We appreciate you taking some time to give us these insights.
Thank you, and thank you for having me.
Thank you, Jackie.
Thank you, Jackie.
Have a good day.
Okay, bye-bye. Bye, Wajiko.